So first up is our meconium aspiration syndrome. Now, meconium is the newborn's first stool, and it is thick, tarry, green-black. If a baby passes this in utero, which can happen because of fetal hypoxia, that meconium can be inhaled. Now, if you had thick tar on lungs, they're not able to expand, right? That thick tar prevents those alveoli from expanding and causes respiratory distress. Now, this is caused, like I said, by fetal hypoxia. So what happens is if the fetus gets hypoxic, we can have relaxation of that anal sphincter, and that's going to cause passage of meconium. And then if they inhale it, that's when we get respiratory distress. So some common causes of this are going to be post-term gestation and placental insufficiency. Now, both of these cause fetal hypoxia because that placenta is not working the way it should be. So with post-term gestation, that placenta has reached its expiration date and that fetus is not getting the blood, oxygen, and nutrients that it needs. And placental insufficiency can happen during labor or towards the end of pregnancy, but either way, that placenta is not getting oxygen and nutrients to that fetus the way that it should. So what can we do to prevent this? We're going to monitor laboring clients for yellow-green amniotic fluid, which indicates meconium. The key here is that we want to identify it early so that we're ready to act. Now, if you notice that yellow-green amniotic fluid, you want to ensure that there's staff trained in neonatal resuscitation present at delivery. All right, so what do we do when that baby is born? Well, what does it mean if that baby is vigorous? Well, it means that they probably did not inhale any meconium and they don't have meconium aspiration. They're crying and active. So in this case, we can just do routine care and put them skin to skin on mom. So what if the baby is non-vigorous? Well, this means that they're limp, they're not crying, they're just hanging there like a dish rag. So if they're non-vigorous, we'll take them to the warmer and prepare for intubation and endotracheal suctioning so that we can clear out those airways.